possibly more involved than anyone in Gallatin County with the COVID-19 pandemic. The Gallatin City County Health Department Health Officer, Matt Kelley, is here making another appearance on the town hall. Matt, thank you for joining us tonight.
Yeah, no problem. Glad to be here.
So first off, with the recent spike in cases, can you briefly discuss kind of a state of the union as to where Gallatin County is right now?
Yeah, I sure can. So we had, as most people are aware, a significant period of time after we did the stay-at-home, after the governor did the stay-at-home order, and we imposed some local regulations where we dropped, and we weren't finding cases for 4, 5, 6 weeks. That's changed dramatically. We're getting to the point now where we're getting double-digit cases most days. We're seeing cases from really most parts of the county. We have cases coming from Big Sky. We have cases coming from West Yellowstone, and we have a really significant number coming from the Gallatin Valley. In Big Sky, I can tell you it's not just concentrated in any one area or one demographic group. We're seeing them in construction. We're seeing them in tourism. We're seeing them in bar settings. We're seeing cases in healthcare settings. And we're seeing cases of visitors and people who live in town year round. There's just one thing that's been really difficult and really challenging over the last 2 to 4 weeks is the cases are coming with a lot more contacts than they used to. When we had people number one, the weather was colder. We had a stay-at-home order in. The pandemic was newer. People were less, I think, tired by it. We were getting cases, and we had a fairly limited number of close contacts. When we get cases now, we just have more cases with a really high number of close contacts. The cases, the average age has dropped significantly. I think when we started, we had in March, our median age was about 43 in Gallatin County. And that's dropped into the mid to upper 20s. And as you get into those lower age brackets, people tend to be more active. A higher percentage of them tend to think they're invincible. And we have a much higher degree much higher number of close contacts. So that's been a really significant challenge. So bottom line is cases from many parts of the county with a lot more contacts makes a lot more work. Makes a lot more work for us and makes the pandemic that much more difficult to contain.
Yeah, absolutely. Thank you for that update. So obviously masks are a very hot topic right now, and there's a lot of discussion surrounding mask requirements in places of business. Is there a possibility that Gallatin County could impose a mask requirement to enter a business?
It's possible. I know that I spent most of today talking with Board of Health members, the county attorney, other elected officials and stakeholders. And I think we're really weighing that. And I think in the next week to 10 days, we're going to see the board probably sometime next week have a meeting to deal with this in some way. I don't want to preempt what they do. They have the ability and the authority to make those decisions. So I'm not going to say what they will do, but I do know that we are getting really significant public input on the mask issue. I think there's some things to remember about that. While they've gotten a lot of attention, and they unfortunately have become this polarizing political partisan issue, regrettably. I think they can and possibly could be a piece of the puzzle. They're not a panacea, and just wearing a mask doesn't give you a force field that protects you from getting COVID. In fact, it does more to protect the people around you. It's really important that we also understand the importance of that social distancing, keeping that 6-foot distance between yourself and others, managing the number of people that you're in close contact with. Remember, close contact is described as being within 6 feet of somebody for 15 or more minutes, especially if you're indoors. We want people to continue to wash their hands. We want people to continue to stay home if they're sick, call their doctor and get tested if that's what the healthcare provider and the person believes is the right thing to do. So I think masks are important. I think they can be a piece of the solution, but they're not an entire solution. And what I would say is I think the Board of Health members in Gallatin County are concerned. They're definitely hearing from a pretty wide spectrum of viewpoints on this. You have people who absolutely think we should snap our fingers and mandate them across the board, and that'll be the end of it. And you have people who think that we should just keep our nose out of that. I think that we'll fall somewhere in the middle of that. A mandate would be difficult in a lot of ways. Enforcement would be challenging, but we're working on it, and I think the board will be taking action here in the next week to 10 days.
Yeah, those are great points. And that actually leads perfectly, the last piece you said there, into my follow-up question. If the mandate were to be enacted, how do you envision it being enforced?
Well, I think, at the end of the day, local health department doesn't have the horses to be out there enforcing masks throughout the county. So we would be working with, number one, the county attorney. We'd be working with local law enforcement. And there would be some degree of responsibility on organizations, whether they be businesses or nonprofits, government organizations, to enforce policies within their domain. I think those are the main ways that you'd enforce it.
Yeah, that makes sense. So testing is obviously increased throughout the state, but on a county level, does Gallatin County currently have enough test kits on hand to continue at this current pace?
We're still doing okay. There's really, thinking about testing, you got to think about two kinds of testing. The testing that we've been doing since the beginning of the pandemic is related to people who are symptomatic and people who are close contacts to people who are symptomatic or known cases. In that kind of testing, we've had pretty good turnaround time. We haven't really had many issues, except at the beginning of the pandemic. I think what Lieutenant Governor Cooney mentioned is really valuable and worth remembering. In early February, when we first started this, I was having to get on the phone with the Centers for Disease Control and ask for permission to send them a specimen. Now we send them to the Bozeman Health test sites, and we get a test done that day, and we're typically getting test results in 24 to 36 hours. We have seen some signs that the pipeline is filling up both on the state level and the national level. That's concerning. That hasn't created a huge problem for us as of yet. And I think that it's important to understand there are two kinds of testing that we're talking about. The kind that we've been pursuing and that the Gallatin City County Health Department is devoting most of its resources to are close contacts of known cases and people who are symptomatic. And we are throwing a bit wider net over known cases to really find people who are in the orbit around known cases in a bigger way than we used to. But that's really our focus. The other kind of testing that you saw in Big Sky last week on Wednesday is what's being termed as surveillance testing. And that really is a term that's kind of a term, it's a variable term depending on who's using it. But that's testing where people can just roll up or get a test, or where people are being identified because of their occupation, but not necessarily because they have symptoms and not necessarily because they're a close contact of a known case. That kind of testing, we're also seeing signs that the pipeline is filling up there, and it's taking a little bit longer. That kind of testing can take between 4 and 7 days to get results. And we're hearing some reports that it's taking longer in some cases. And so there's a concern there. I think one of the things that's a little bit concerning about that is, Bozeman Health has some capacity, has the machinery to do more tests. And we'd like to see the federal government come through with some of the reagents and some of the materials we need to really expand that capacity here in Gallatin County. What I can tell you right now is when we have a case, when we have close contacts of a case, we have people who are symptomatic, we're able to get them into testing sites and get those tests around the state public health lab, in most cases with little delay.
Well, that's good news. While we're on the topic of testing, there's been debate recently regarding false positive tests. Based on your observations, how effective are the COVID-19 tests at this point?
Well, I think the concern there is when you're using the COVID-19 test, that a PCR testing that we're doing is a diagnostic test. It's not really designed to be a screening test. But what I mean by that is when you use it in a population where there's a low prevalence of disease, there's a higher proportion of your positives are more likely to be false positives. So for instance, you're testing 1,000 people, and if your prevalence of disease in the community is pretty low, then you might get 2 or 3 false positives, and you might get 1 or 2 actual positives, and your proportion of false positives to real positives is lower, and so your payoff for the testing is less. That's a concern, although lately it's less and less of a concern in Gallatin County. We're seeing enough cases that it's going to be fascinating to see what the results are from the 500 or 600 or 700 tests that were done in Big Sky last week, and really see if we can catch some positives. So, the other thing I would say about that surveillance testing, so if, that testing where you're just showing up, you're not being sent by the health department, you're not being sent by your doctor, that kind of testing, for the individual, it has somewhat limited utility. It really tells you at the moment that specimen is gathered, whether your system is producing the RNA, the genetic material, whether that swab is detecting the genetic material at that moment. It doesn't tell you anything about 30 seconds after that moment when you walk out the door and you might be coming into contact with others. And so you really need people to be aware. Just because you get a negative test does not mean you're impervious to getting the disease in the future. And just because you're wearing a mask, the same thing, doesn't mean you're impervious of getting the disease. All these things can be part of the solution, but they can also be a problem if they give people a false sense of security.
Yeah, absolutely. Well, while we're discussing that surveillance testing that was done here in Big Sky, some reports were that results weren't going to come back until 7 to 10 days after the fact. So with that being said, how effective is that testing method, given that people would be sick for a full week?
Well, again, and just to be clear, when we have somebody who's sick, we have somebody who's a close contact, those specimens are going to the state public health lab, and that turnaround is much faster. That surveillance testing is taking longer, and that's what I mean about it not being a great screener, because by the time we get those test results back, we're pretty far down the road. Now, from a big picture public health perspective, as I mentioned, it'll be interesting to us on a population level to get a sense of how many positives we're getting out of that pretty high number of tests that we did. And that's why we're really putting our resources, our local public health resources, into testing people who are symptomatic and people who are close contacts of known cases.
Yeah, thank you for expanding on that.
Sure.
The messaging surrounding safety precautions for the virus have fluctuated. Are gloves still an effective means to slow the spread?
Our biggest piece of advice is to wash your hands frequently and thoroughly. If you use a dirty glove, it's really not much better than having dirty hands. Again, that can provide a false sense of security. Our advice is to wear a mask where you can't socially distance, wash your hands frequently, and keep that social distance between yourself and others whenever possible.
Yeah, perfect. Last one I've got for you. So to date, there's been 326 confirmed cases of COVID-19 in Gallatin County. We currently have 0 hospitalizations and 1 death. How would you classify the severity of the virus?
Well, the really hard thing about this virus, the most sort of head scratching and troublesome thing about it, is the different way that it affects different people. And it's really difficult to project who's gonna end up in the hospital and who's not. I think we have had success keeping people out of the hospital in Gallatin County for 2 primary reasons. One is I think older people are being really careful, and the cases that we're seeing tend to be in a younger group. That's good because younger people tend to do better with the disease. Although I would caution, younger people can catch the disease, they can wind up in the hospital with the disease, and they have died from the disease. So I say that just to explain why we probably have had lower hospitalizations, not to give anybody a false sense of security. The other reason I think we've had some success in Gallatin County is that way back toward the beginning of the pandemic on March 7th, we brought on staffing to really work with those long-term care facilities and senior facilities. Those facilities are really driving an awful lot of the mortality that we're seeing nationwide. We have so far, knock on wood, been successful keeping cases out of those facilities. And that's why we've been pretty cautious about opening those facilities up. I know the board is really interested in opening those facilities up and allowing some visitors. We want to be really careful with that because while we do want seniors to be more connected to their loved ones, we want to be careful and continue the success we've had at keeping seniors alive and keeping them out of the hospital. So we're going to be careful with that. But I think I think the pandemic is serious. It's getting more serious in Gallatin County. We're seeing more cases, and the more cases we have, the more likely we are going to have more people in the hospital, and the more likely we are to see mortality. We're not there yet, but that's why we want to really think carefully about things like a mask rule, and doing some things now to prevent being in a situation like we're seeing in Texas and Florida, Arizona, those kinds of places.
Yeah, thank you for all the information, Matt. I'm going to toss it over to Joe to see if he has any follow-up or audience questions.
Yeah, thank you, Brandon, and thanks, Matt, Kelley, for being on the show again. Really appreciate it. I know you've got a lot going on, but it's it's really important, I think, for our audience to hear from you and these other panelists as we go forward. But I wanted to ask you, there's been some talk of, it sounds like there's an analyzer machine at Big Sky Medical Center and/or Bozeman Health. Can you talk about that and if and when that might be utilized?
Yeah, I'm not a lab technician, so I have to be a little bit careful about getting out over my skis there. But there is a machine that can do a fairly high number of tests. We've talked to the state. I think the state would love to provide whatever resources they have, but they simply don't have the test kits to hand out. They need to keep the state public health lab running. So my understanding, talking to Bozeman Health and talking to some folks in Big Sky, is that if we can get the reagent, if we can get the test kits, it could pretty dramatically expand our capacity here locally, which would be good news. That would allow us to do tests more quickly. It would also take some pressure off of the state public health lab. We're having, between Yellowstone, Missoula, and Gallatin County, I think we're probably producing a fairly significant percentage of their test burden. And so if we can take some of that off, that would help the state public health lab. To date, I think it's been a little bit troubling to not be able to get the test kits that they would need to run those. And I think that bottleneck apparently is at the federal level.
Interesting. Yeah. Well, and it does seem like 7 to 10 days is a tough and long turnaround time for tests to come through, especially as people visit for a week or 10 days at a time, or people are tested and they a week, 10 days later, they get their results after they've been to the farmer's market, after they've been to restaurants. I don't envy your position or the Bozeman Health or Big Sky Medical Center. That's a difficult place to be, especially if it's coming from the top.
I would agree, and I would add that even that week to 10 days, the state has detected some false positives in that. So the state typically want to redo those positive tests to make sure that we've actually got a positive before we start putting people into quarantine. So it is a problem, I think, nationally. But again, I want to create a differentiation between that surveillance testing of people in the community who don't have symptoms and are in close contact, and the testing we're doing of people who are symptomatic or close contacts. That's a different kind of testing. It's going through the state public health lab, and that turnaround time has tended to be better.
Mm-hmm. Well, a couple quick questions from the audience. We've got one from Linda here. Can we expect to hear from the health department if we have been exposed to someone with a positive test?
Yes.
And then the follow-up, just when will the results from last Wednesday's Big Sky Medical Clinic test be public?
I think, let's take the last one first. From what I understand from the state, the earliest we'll start to see those results will be the end of this week. I don't know if we know more than that, we'll communicate that up to the community. Mm-hmm. Remind me again, the first part of your question? Oh,
sure. Yeah, can people expect to be notified from the health department?
Yeah, so the way yes, the short answer is yes. And the way contact tracing works, when we get a case, we get on the phone with that person and we do a fairly extensive interview with that person to determine who their close contacts are. Once we have that list of close contacts, it creates what's called a line list. We go down that line list and we contact those individuals. We let them know that they've been close contacts. Generally, they're asked to go get a test and they're asked to quarantine. close contact is defined as being within 6 feet of somebody for 15 or more minutes. You know, so the answer is yes. If you've been identified as somebody who is one of those close contacts, we'll call you and we'll work with you. A public health nurse will contact you and talk to you about what your options are.
Understood. You know, last one, you know, we have one from Cheryl. Any idea what criteria needs to happen for when Montana will be ready to move to phase 3? And following up, can Gallatin County go to phase 3 ahead of the state?
You know, my concern right now is keeping us in phase 2 and doing everything we can to keep us in phase 2 and not going backwards. I mean, we're seeing enough cases. We're seeing some things happen nationally in the South that are really very concerning. We're seeing hospitals filling up in the South, and we need to be very careful about what we're doing now to prevent us from being in the same situation and having to backslide. You're seeing bars being closed, restaurants being closed. We're seeing it really slowing down in those other states. And my thought right now here in Montana and Gallatin County is before we even think about going to phase 3, we need to really do some things in terms of making sure that we're conducting ourselves and not out having a huge number of close contacts, wearing masks, managing the number of people that we have to reduce the number of cases that we're getting on a day-to-day basis. But as long as these case numbers keep rising, it's going to be very difficult to contemplate opening up any further.